Hi, hi everyone. Welcome to the Psi Upsilon program for February. We are delighted to have as our honored guest this evening, Dr. Kathy Catrambone, the immediate past president of Sigma. And she's agreed to speak to us today about her journey through Sigma and her leadership journey in the different positions. My name is Carol Lisk, and I'm the current president of Psi Upsilon, and it's been my pleasure to know Kathy for over 10 years. Dr. Kathy Catrambone is an associate professor at Rush University College of Nursing. She received her BSN from Loyola University in Chicago and her MSN and PhD from Rush University in Chicago. She's currently a faculty member in the DNP and PhD programs with an emphasis on outcomes research, evidence-based practice, leadership development, and health policy. Her clinical background is in adult pulmonary critical care. She's a pulmonary nurse expert and well known throughout the state and the nation for her leadership and advocacy in promoting lung health, smoke-free living, and clean air. She's worked tirelessly over the last 20 years in advocacy efforts to enact smoke-free legislation in the Chicago, Illinois area, and she has served on the Respiratory Health Association Board of Directors and Executive Committee for over 20 years. She was also president of their nursing assembly. She was awarded the Herbert DeYoung Medal for her leadership in advancing lung health in Chicago, and she's currently co-chair of the Illinois Department of Public Health's Asthma Partnership Executive Committee that executes the state asthma plan. In addition, the Department of Public Health has funded her research that focuses on asthma surveillance and system-level interventions to promote guidelines in the emergency department setting. She's presented her research at national and international meetings and has published her work in peer-reviewed journals. She's also a fellow in the American Academy of Nursing and the Institute of Medicine of Chicago. As I've mentioned, I have had the pleasure of knowing Kathy for over 10 years and first met her when she served as the region coordinator in the Chicago area and Illinois. And I was then president of the Lambda Upsilon at Large chapter at Aurora and Benedictine Universities. As a new chapter leader, she was and continues to be a valuable resource, mentor, and friend to me. Following years of service at the local and regional levels and the 10 years of distinguished service at the international level, Dr. Catrambone served as president of the Honor Society of Nursing, the Sigma Theta Tau International, for the 2015-2017 biennium. Her call to action was influence to advance global nursing through philanthropy, lifelong learning, policy, and near and dear to my heart, advocacy. With over 135 members in 91 countries worldwide, Kathy's provided strategic leadership in advancing the World Health Mission of Sigma. She remains a leader in the Sigma Global Advisory Panel for the Future of Nursing and has established a voice and vision for the future of nursing and midwifery in advancing global health while simultaneously strengthening professional roles. So Kathy, welcome. Thank you so much.
Thank you so much. It's a pleasure to be here this evening. I just want to say thank you for that introduction. Again, it's been a pleasure, certainly, Carol, to know you all these years. And I am delighted to be here with the Psi Upsilon chapter. And I'm delighted that we have a handful of members who are on the call this evening. I just want to start off by saying, before we actually get into the content, that I see this as a beginning conversation, and I would like to invite those who are on the call and certainly other members within the chapter that if I could ever do anything to help you in terms of your developing your career or your leadership trajectory within the organization, please feel free to contact me. And I will provide my contact information to Carol. And I have to say that one of the joys of my engagement within Sigma Theta Tau really has been through the relationships that we have with one another. And that, to me, is very special. So I just want to put that open invitation out to everyone that to feel free to contact me. The other thing I will say is that Carol and I, in terms of planning the conversation this evening, is that we have left plenty of time for questions and for conversation. We'll use the technology to the best of our ability to be able to certainly dialogue in areas that are of particular interest to you, to those of you who are on the call.
Absolutely. Thank you so much. And again, if you think of something after the event this evening, we will have not only Kathy's contact information, but we can always identify some key issues and bring you back again, which we would look forward to.
Absolutely.
Thank you, Kathy.
Sure,
so, Kathy, tell us a little bit about your membership in Sigma. When did you become a member, and what do you recall your experience as a new member that helped you appreciate the Sigma mission and the organization?
Okay. Well, I became a member of the organization back in 1981, and at that time I was in my graduate program, and the faculty members encouraged me to apply and said that unlike other organizations that you belong to, one of the very special things about Sigma is that in addition to its World Health Mission, it gives you the opportunity to network with nurses from around the world. And I would have to say that piece really intrigued me. And I was very fortunate when I became inducted. And as many of you may know, that there are different ways that you become inducted into the organization. You can come in as while you're in your bachelor's or graduate program, or you can come in as a nurse leader. And when I joined the chapter again, I joined at Rush University, and it's the Gamma Phi chapter. And actually this year, we'll be celebrating our 40th anniversary.
Oh, wonderful.
And what I found it's very exciting. We're gearing up for our big celebration in June. And one of the things that I really appreciated, but when you think about the mission of the organization, advancing global health and our focus on leadership, scholarship, and service, those things are very important. And I think that what I found intriguing about those is that I think that many of us belong to organizations that could be very specific to where our clinical interests are. Like mine is asthma, so I'm very active in, like, for example, the Respiratory Health Association, the American Lung Association. But what I found really valuable about my membership in Sigma Theta Tau, it was more on a global general level, looking again at the importance of leadership, scholarship, and service. And again, the opportunities that you have to not only network with your colleagues locally, but regionally and internationally, and they make that so easy to accomplish. And our chapter, again, what I enjoy about our chapter is I think we have excellent programming, that we also are very much engaged in the community around the areas that we serve. We've got a lot of networking that we do with the chapters within our region. So again, lots of opportunity for professional growth for various venues.
You know, before we get into discussing a little bit about your journey in the global, I think it's been interesting to see the evolution of Sigma as well over particularly the last 10 years. Really reaching out more to clinical organizations and also, having an impact, at the global level.
Absolutely.
But I've seen a real evolution of the organization, not just concentrating on academic members. Would you agree?
Yeah, I'll say a little bit about that. It was actually in the last biennia that we did approve a bylaw change. And so historically, entry into the organization is through a chapter that is affiliated with a school of nursing. And now chapters have the capability of becoming what are called at-large chapters. And so clinical entities can now become part of the at-large chapter structure. So, and what's good about that is when you think about it, in some of the more remote areas where there may not be a school of nursing, but you have these clinical entities that they then can become part of the structure, the at-large structure, so they have opportunity to participate within the organization. And I think that's a really important bylaw and operational change for the organization that will certainly promote engaging our clinical entities, which are very important certainly to our voice as nurses and to the mission that we as an organization are committed to achieving.
Absolutely.
So very good, a very important point to bring up.
They have that touch point with the consumers. They're actually,
right.
With our endpoint, our consumers.
Absolutely. The other thing I'll point out is that in the last 2 biennia and moving forward, we've been very intentional as an organization because we call ourselves Sigma Theta Tau International. International is added to our organization. I can't remember what year that was, but we are being very intentional about our growth, certainly outside North America. And for those of you who attended the biennial convention back in October, we did reveal that we are creating what are called these global regional structures, so that we'll have groups in the different regions of the world that will help to represent the chapters and the members in that area, so that as the needs that are particular to that region, that we'll have the opportunity to address them through the information that we are able to receive from those individuals. So
right, and that's
a little digression,
so
but I just thought I'd mention that.
No, that's wonderful because I think that's been part of the exciting view of what's happening with the organization and our outreach
right.
and the lives we touch. So as you think about your Sigma leadership journey, can you share with us a little bit about your leadership progression and where it led you?
Sure. First, I'll start off by saying a little bit about the impact that the organization has had on my journey. And I'll just a little bit about myself. I was born and raised in Chicago, and I didn't realize until becoming part of the organization that I was very much a North American-centric person, and even what I would say is Chicago-centric. I've told this to Carol on a personal note. I've lived in Chicago my whole life, and I've moved 8 times, and in those 8 moves, it has been within a 5-mile radius. So and what I appreciated about my leadership journey in Sigma is that I really feel I have transformed as a leader from being a very Chicago, Illinois, North America-centric person to much more, to have a much more global perspective. And I think what's important about that is that, the world is a small place, and that we as a profession are facing issues that are relevant here and relevant really around the world. And so I feel like that part of my leadership journey I really appreciate in terms of my exposure to Sigma, because it's made me a much more global it's given me a much more global perspective, and it's really helped to expand my thinking. But in terms of my journey, I happen to be the type of person who's very intentional about the journey. I think it's important, certainly, that as opportunities arise, that come from, you may not have expected, and it's certainly important to consider those. But where my journey began is I started at the chapter level, which is an important place to start when you think about the complexity of the organization. I started off as a chapter leader, and one of the things that had really helped me appreciate the organization, and I'll step back, I want to say that I encourage everybody who's here who's with us tonight, is that to get an appreciation for what Sigma is all about, I highly encourage people to attend the biennial convention. And Carol, I'm sure you will agree with that.
Yeah.
It's not until you go to the convention that you really get an idea of the magnitude and the scope of the organization. And by that I mean, I remember going to my first convention and looking at the people who were engaged in Sigma, individuals who were the authors of the books that we were learning from in school, some of the big names in nursing who were who were out on the global stage advocating for the profession, advocating for health. And what I was impressed there is that the humility in those individuals, their interest in you as an individual and in your leadership development, and being available and willing to help in any way that they could. So I would say in terms of your own personal journeys, that a good way to start, in addition to becoming involved at the chapter level, is to take an opportunity to attend biennial convention or any of the international programs to get really a feeling for what the organization is about. The other thing that's important about that is when you think about it, how interesting it is to be in a room and we have members from 91 countries that are representative of our membership. So thinking about the opportunity as you are present at these international activities, the opportunity to meet people from around the world and have those important conversations and to be able to collaborate and to share ideas. So I'll just start there. But now in terms of my journey, it was very helpful to be a chapter leader, to be able to get an appreciation for what are the challenges in terms of what the chapters face. And as you could imagine, things like, the challenges you have in terms of membership growth and doing the best you can to meet the needs of your members. And I got a full appreciation for what it took to run a chapter, how to engage individuals in the mission, how to engage individuals in the organization. And it was after that I realized that, I knew for myself personally that two things, that I wanted to serve a local mission that had to do with where my clinical practice was. And secondarily, I knew that I would want, leadership has always been, it's been part of my DNA. And I knew that at some point in my career that I would want to be involved in leadership in a national or an international organization. And I was very active in critical care. And I decided again, after attending biennial convention, and looking at the mission of the organizations, that Sigma would be the organization that I would commit to service for the next, at least for the next decade. And from that point forward, after being a chapter leader, I took the opportunity then to talk with, there's a position called the regional coordinator, and I spoke with the regional coordinator, and she gave me some ideas about what would be a good trajectory. And so the way I looked at my trajectory in the organization was that I would go from the local levels of chapter, go to regional and to international. And the good thing is you never know what the outcome of these putting yourself out there, but I just felt it's just important to put myself at the table, and whatever the outcome would be the outcome. And I was very fortunate that my service in the organization over the past 10 years has been a regional coordinator, Region 5, and it was kind of interesting because at that time the regional structure has changed a bit, but at that time I was responsible for working with the chapter leaders, and again, having understood the role, working with the chapter leaders in Illinois, Missouri, Pakistan, and Brazil. So it's kind of a very interesting mix of chapter leaders, and then from there progressed to what was called the Regional Chapter Coordinating Committee Chair. And what I appreciated about that position was having the opportunity to work with the regional coordinators who worked with the chapter leaders to help them have their chapters be as vital and well-functioning as they could be.
And then at that point, weren't you also on the board of directors as well then?
Yeah, and then
in that position?
Yep, and there was a bylaw change at that point where the Regional Chapter Coordinating Committee Chair, again, was on the board, and then getting exposure to what happens from a strategic standpoint on the international board, and then going then from vice president to president-elect and president. So it was a trajectory over about a 10-year period. I feel that personally, tremendous growth in my perspective about, again, the importance of our role as nurses in impacting global health and impacting the profession. And I think some of the decisions we make when we want to pursue leadership positions like that is, how feasible is it? What type of support do you get? And one of the things that I think is really important about, for those of you on the call who think may be interested in leadership at that level, again, we have 135,000 members in 91 countries. We have a international staff of over almost 100 individuals. And what I appreciated about being at the board level was that you truly could think strategically and focus on the important work of the organization, knowing that whatever decisions you made, you had a very capable and talented staff that would then carry out the activities of the important and the strategic decisions made by the board. So, and it was of all the board experiences I've had, I'd have to say it was the most to date, probably the best experience I've had. Again, they make it very easy for you, again, to do your role and to do it well and to not have to worry about, sometimes I know, like when I've been on board, you're careful about what you say because you're the one that's going to be doing it. And not that you are opposed to that, but you only have so many hours to your day. And you want to really use your talent to its fullest, knowing that you can pass it off on them to the staff and they will carry through on that and carry through very well.
Absolutely. Well, and as a brand new chapter, leading a new chapter, having been involved in chapters that were 20 years old and some just a few years old, their support is just really
amazing,
invaluable. And they've worked so beautifully with each of the officers and committee chair, and that they really are very giving. They're tremendous servant leaders.
Yeah. The other thing I just want to point out again, this new generation of nurses they are much more worldly than I would say my generation was. And another important thing for individuals that are members who are interested in pursuing leadership positions, not only within Sigma but in other organizations. But one of the things that I also appreciate about Sigma is that we do have, we are greatly respected in the global arena. And what I found fascinating was opportunities not only to meet with nurses, but opportunities to meet with leaders from around the world. When I think about, for example, and we'll talk a little bit later about this Gap Fund initiative, but to have the opportunity to sit one-on-one with Princess Muna Al Hussein in Jordan in her palace to talk about Gap Fund, and I think, I just think the space that we occupy in the global arena is well respected, and it's deep, and so the experiences that we have as members to again contribute to that mission, I think is amazing.
Yes, I agree.
And I'm just wondering, we covered quite a bit of information at this point. Can we entertain questions, or should we continue through the rest of them and then entertain questions?
Does anybody have a question they'd like to post? I think that's a great idea. And while we're waiting to see, I think one of the things that's really fascinating is how our organization has been quite instrumental in raising the visibility of nursing throughout the world, where in many countries where nursing has really struggled for a voice. And not that we haven't in North America, but we were certainly, and I think we've become more appreciative of what we have when we see what so many of the other nurses are dealing with in war-torn areas and in third world countries. And the mission and vision is the same, but the resources are certainly not the same, nor is their strength of voice. So talking a little bit about the global health arena, what are some ways, I know you've talked about GAPFON, which is the global panel for the future of nursing and midwifery, but also the UN and our involvement there. Can you talk a little bit about how Sigma's been active in these global health policy-making bodies?
First, I'll just start by saying is that we're very fortunate that we do have a presence at the United Nations. Back in 2008, we were granted NGO, which is non-governmental organization status, which allows us to be at the UN to observe. But we're very proud that we now hold ECOSOC status, which stands for Economic and Social Council status, which gives us the opportunity to provide testimony on important health matters. So that is very important. We also have a liaison. Some of you may know Dr. Connie Silvan-Sensor, who's a former regional coordinator. And she is our liaison to the UN, as well as we do have 2 youth reps there. So we definitely have a presence there. Many of you, I'm sure, have heard of the International Council of Nurses. We have affiliated status with ICN. There's a group called CUG, which stands for Consortium of Universities for Global Health, and our past president, Dr. Hester Klopper, is on the board of directors there. And Dr. Beth Tiggis, who's our current president, they both actually, the CUG conference is coming up in 2 weeks, and they'll be doing some presentations there. So certainly we have a visibility there. And then I just want to say just a little bit about GAPFON. Again, this is a really important initiative, and it started about 2 years ago, and we have finished what we are calling our talking phase, where it stands for the Global Advisory Panel on the Future of Nursing and Midwifery. And the vision of it is to establish a voice and a vision for the future of nursing and midwifery and global health. And in a nutshell, it's complex, but basically what we've achieved to this point is we convened actually a panel of nurse leaders with global representation from 9 countries to talk about what are the key issues facing nursing and global health, and took those conversations then to the different regions over a period of a little bit over a year, then took those priority areas that this panel identified and had discussions with leaders in the different regions of the world to say, how do these resonate with you? Are these the right priorities? Should anything be added? We took all that information, assimilated it. We prepared a report that was released in July. And for anybody who has any interest in reading it, it's an interesting report. It's available on the GAPFON website, which is gapfon.org. And now what we are moving into is what we're calling the implementation phase. And we'll give people, what we plan to do is to engage key nurse leaders and stakeholders and chapters and members involved in these initiatives around the profession and around global health. So it's a great initiative. We are occupying a space in the global arena, again, that's a very important space, again, that will help move those agendas forward. And when you think about it, you know, as nurses, we are very prepared for, and our voice is really important in those conversations. Yeah. We have the respect of the public, we have the knowledge of science, and the experience to bring to push those conversations forward. So you'll be hearing, definitely be hearing more about that.
Yeah, and I think what was fascinating for the international chair meeting that we had in January in Indy, when Cindy was talking about GAPFON, what was fascinating was despite so many of the differences worldwide, there were some common threads that were coming through in all of these advisory panels in the different regions of the world. So again, making our nursing world yet even smaller as well.
Right, very important. And I agree with you. It's very interesting. While there may be some differences there, we are still all struggling with similar things. So, for example, leadership, the importance of leadership at all levels of nursing, the communicable diseases, I mean, things like that are very important. So anyway, so you'll be hearing more about that. We actually just heard from our Chief Executive Officer that we do have a Twitter handle now for GAPFON, so you'll be able to follow that information in Twitter and certainly through our website.
And I think the other thing that was fascinating that she was talking about is there are pages and pages of recommendations. I think there's almost 100 recommendations that came out of all the regional panels. And what they're hoping to do is to do some intentional strategic partnering. So if there are universities or medical centers or various healthcare organizations that either have an interest or a specialty expertise in a certain area, that they could be a part of now identifying the strategic solutions, which I think is furthering our reach into the healthcare community, which was pretty exciting.
Exactly. Yeah, and you're exactly right. There were just about 100 recommendations, and we have set up at the website, again, what you've described is organizations, other stakeholders where there's a good mission match, where people can help move those agendas forward, that we're encouraging people to step forward. And we will certainly also go through a process of seeking out organizations and stakeholders that we know that will be a good match. So, for example, something that has to do with regulation, the International Council of Nurses, AACN, those would be two important groups that work together on that area. So just as an example.
Oh, that's great. Yes, thank you so much. So, you know, we've talked of constantly the importance of input from nurses around the world, and but in our current healthcare climate, why do you see why do you see the voice of nursing being so important and crucial to the movement of positive healthcare outcomes?
Again, we are one of the largest healthcare professional groups with over 19 million nurses and midwives worldwide. So when you think about sheer numbers, the respect that we have for the public, our knowledge of science, the fact that we interact with our citizens through all stages of life, that we are in a prime position to be able to represent the clients, the people that we serve, and to be able to move those agendas forward. And looking at, for example, things like health equity, universal access to health care, that type of thing, we are well positioned for those many reasons to be important parts of those conversations, to help move those agendas forward, to represent the citizens that we serve. And I think that's really important. I think, again, the talent that we bring to the table, the knowledge we bring to the table, the respect that we have from the public, I think it's important that we have a voice at the table in those conversations.
Agreed. So as we circle back and think about what we discussed at the very beginning, it really does start with membership, because Sigma can't do what it's doing without the strength of its membership. And, you know, of course, our membership fees are really quite nominal when you look at other professional organizations. I know for some it is a lot, and we do understand that, but the money is being so well served in terms of what we're trying to do in terms of the mission and vision. So when you think about even at the local level, I remember when Dr. Klopper was president, her call to action was serving locally, regionally, and globally. So you always have to have that foundation at the local level and knowing what the benefits are and really using the benefits of Sigma. So in your observation, what are some of the most essential benefits that a lot of members sometimes don't take advantage of, or those that you see being most well utilized?
Right. Well, this is the part that I call the infomercial. So the infomercial is that, again, I can't emphasize enough first of all, that I think unlike other organizations, one of the benefits of membership in Sigma is that there's opportunities and there are knowledge, products, and services available to members over the course of their career. And I think that's quite unique to Sigma. Really, over the course of your career, whether you're an entry-level nurse, mid-career, near retirement, there is something there for everyone. And in terms of our knowledge, products, and services, I think for those of you who are familiar with our journals, I think our journals, the Journal of Nursing Scholarship, Worldviews on Evidence-Based Nursing, Reflections on Nursing Leadership are certainly very useful and innovative journals, and important information to share there. We have several books that come out. I think we publish 14 books a year, and it's not many of our books have received AJN Nursing Awards. So we have, in terms of knowledge products, we have wonderful knowledge products to share with our members. If you look at our leadership academies, the Geriatric Nursing Leadership Academy, the Nurse Faculty Leadership, Maternal Child, there are these leadership academies that people can be involved in that will help to advance advance you in your trajectory in those particular clinical practice areas. For those who are in education, the Centers for Nursing Excellence and Nursing Education, we have lots of opportunities for career advancement there. Especially to our newcomers, I don't know if people are aware that you'll have access to 32 hours of free CE online courses, which certainly is important. And again, I look at, those are just some of the knowledge of products and services that are available, but again, as a global organization, your opportunity to network and engage with members, again, from around the world, and all the opportunities for collaboration and opportunities to learn, to collaborate together on whether it's service projects, your leadership development, wanting to collaborate on research activities, wanting to collaborate to move, for example, we're very focused on the UN Sustainable Development Goals, working together to advance those agendas forward are important too.
Absolutely, absolutely. So one of the things you mentioned very early on was looking at things very strategically. In your Sigma world, your choices were intentional, not necessarily knowing what the outcome would be, but every step of the journey, really added to your palette of expertise. But you also mentioned passion. How does leveraging our passion, do you think, play into not only our nursing careers and trajectories, but our membership in Sigma?
I would say, we all only have 24 hours to our day, and I think it's really important that when you think about your professional growth, whether it be your clinical practice area or your leadership, to be intentional about your journey. And I think one of the things where it begins is, what do you feel passionate about? And then taking that passion, and my 3 steps is number 1, discover what your passion is, be intentional about your journey, and that is, it may include seeking mentors, and then put yourself at the table. Don't wait to be asked to put yourself there. And again, if I can use myself for an example, again, my 2 areas of passion were lung health and also leadership in, like I said, organizational leadership. And I knew those were my 2 areas of passion. And where I began my journey as a new nurse coming into the profession, it was not very long after I became a new nurse, I realized that working on a pulmonary unit, that my area of passion was lung health. And then I sought out a mentor to help me figure out where could I best invest my energies to make an impact on lung health in my local community. And so having the opportunity to be involved, for example, within the Respiratory Health Association, which is formerly the American Lung Association of Chicago, and in there opened up an entire new world, having the opportunity to advocate for smoke-free living, clean air, raising the tobacco taxes, raising the age in which cigarettes can, tobacco products would be sold to the youth, and having opportunities to advocate for clean air, testifying before the Environmental Protection Agency. So again, finding what you're passionate about, whether it's your clinical or for me. And I think within Sigma, the opportunities to pursue your clinical practice areas, your research areas, your areas of leadership, there's opportunities for growth there, taking advantage again on the products and services that are available to us, and again, the opportunity for collaboration. So I would say, figure out your passion, be intentional, put yourself at the table, and seek out those opportunities.
Excellent points. Now, we do have a few questions, but I did, as you were talking, I thought of a few other things, that the Sigma Foundation and the importance of the foundation in funding research. We've done that, internationally, but that's also a wonderful benefit to members to be able to apply for research grants, whether it's, master's, doctoral, or postdoc work, and the mentor piece. I know we have the global leadership community. I've actually just been paired with a nurse leader in Queensland, at the University of Queensland. And so I'll be mentoring her for the next biennial year. But there are some great opportunities for mentoring, and I think finding a good mentor also makes a difference, and working with that person to help you make some very well-founded decisions on your career trajectory, don't you think?
Intentional and well-informed decisions, absolutely. And thank you for your service. That's why you're able to do that. Yeah.
Oh, you're welcome. I'm pretty excited. It's just hard to find time to meet because she's 14 hours difference, but.
Right. And you bring up another important piece that, again, depending on where people are at their careers, is not only taking advantage of the opportunities for your learning, but also your opportunities to give back, like you were saying, your opportunity to be mentors to others, because in giving you receive also, and there's great opportunities there as well.
Absolutely.
You have to be utilize your talents to help improve or move the career trajectory of another individual.
Yes. Well, actually, we do have two questions. The first question is from Jeanette Benson. She was the previous secretary of the board, and she's now our chair of programming. And by the way, Jeanette, thank you so much for helping coordinate these wonderful programs. Her question is, as Psi Upsilon has members all over the country, how would you suggest that members become involved in individual community health issues? And she also thanks you for joining us this evening. So how would you suggest that members become involved in individual community health issues? It's a great question.
Yeah, I would say what it starts off with is doing an assessment of where the needs are in your community. And so I could use, for example, I could use my community for example. In Chicago, one of the major health issues we have here is, for example, the incidence of asthma is very high in the community. And so one of the projects that we did is in terms of doing the assessment to look at where are really the hot spots in Chicago. And then we took the opportunity to actually engage with one of the community organizations where we actually provided education to the youth who have asthma, so teaching them how to use their metered-dose inhalers properly, how to do symptom recognition. So what I would say is, in terms of engaging with your community, is to do an assessment basically of where the needs are and and look to see the match in terms of the talent that you have within your membership and where the passion is, and then extend yourself to the community and work on projects that have meaning to the community and are addressing an identified need.
Excellent advice. And the other thing that I know is that in many communities, their boards of health, and the mental health boards, they're always looking for medical health professionals to serve on those boards, and sometimes just seeking them out and putting your name forward. And when terms are ending, you have great opportunities. They just don't know you're there. That started a little bit of my political appointments as well. So we do have one other question, Janine Barrett. Janine, again, it's like these were planted questions. Janine is our technology chair, and she has helped facilitate this program this evening and coordinates all of our Blue Gene technology and worked with Kathy and I in preparing for this evening. So thank you, Janine. Her question is, how can new members become more involved in the international initiatives, Sigma's international initiatives?
Well, one important area we do have at the international level, and I got to think of the exact name of it, the group that you co-chaired.
The new Next Generation Leaders?
Next Generation
Leaders Task Force, yes.
Right. I can tell you at the start of each biennia, for those who are interested in serving at the international level, especially our newcomers, that particular group, if anybody has an interest in that, at the start of the biennia, the new incoming president looks at all those task force and advisory committee and makes appointments, and that's a wonderful group to become involved in. And our incoming president-elect, or our president-elect currently, Dr. Rick Picardi, he will be making those appointments. And certainly, if there's any interest there, that you can email him and express an interest. And then I've got to think about that one for. I think another way to be involved is looking at the programs that are offered, and I would say attending the programs. And so, like for example, we'll be hosting the Healthy Work Environment. No, the Leadership Connection, which is coming up in
September.
In September. To go to the programs and to network with other individuals to see, what are some of the activities that are going on, what are their opportunities for collaboration there. I think that's a great way to become involved. I think at the chapter level, they're interested in the international level. I would say I probably would start there in terms of engagement. Yeah,
I agree. And nursing, the Leadership Connection's a great suggestion because they've got the day, at least they have in the past, where a day typically focused on leadership and nursing. And then there was a day that focused primarily on programs for leadership, chapter leadership. So it really helped us, build our palette of leadership skills in different arenas. I think the other thing, too, is investing in those conferences, that, putting a little bit aside every month so it doesn't break your budget when the registration comes around, but being able to network and really rub elbows with people from all over the world. And you'd be surprised about the organizations you hear about and the committees that you hear about or the initiatives. So just kind of, really doing a little bit of your Sigma forensics, I call it. And again, just truly, and I know this sounds self-serving, but I don't mean it this way, but staying involved in the chapter, because the chapters do align all of our activities with the mission and vision of Sigma. And we do try to share like these types of wonderful programs about what's going on so that we feel like we're part of that larger organization, that we're just not isolated in a silo.
Right. The other thing, the other recommendation I would make is, again, at the start of the biennia, the president shares the call to action, and what I would encourage our newer members is to actually go to the website and look at the call to action, because in the call to action, then there are individual activities that people can engage in that will help advance the call to action for the organization. So, like for example, what you mentioned earlier, in my last term, my areas were influence through advocacy, policy, lifelong learning, and philanthropy. And I actually identified ways in which members could be involved to move that agenda forward. And there's opportunity there for individuals, so our newcomers to the organization, to be able to contribute. So I think that's another really important area that I would engage in. And not only doing it and getting the satisfaction of doing it, knowing that you're part of moving the organization's agenda forward, but also to share those activities with the chapter, because for those of you who may not know, every biennial we give out what are called Chapter Key Awards, and what it does, it awards chapters for their excellence and how they're contributing to the call to action. So if people engage in those activities, to share those at the chapter level so that the chapter can be proud of those things and report on those. And it certainly will meeting the criteria for that.
Absolutely. We did receive one more question. This is from Philip Tarantino. He's the chair of our finance committee and fairly new to WGU. Oh, it's a great find. His question is, in our global community, it's evident that determinants of health, safe drinking water, safe food, adequate nutrition and housing, and gender equality are vital to good health. How do you see Sigma's many leaders around the world organizing and impacting these important issues? And I'm thinking also of our involvement at the UN and the global health initiatives. But
in many ways, we have opportunity within the UN to provide important testimony on those issues, and those important issues that certainly are raised within the UN. I look at GAPFON, and a number of those issues will be part of the GAPFON agenda. And so I see that, we certainly will have opportunities to help impact that agenda through, again, pulling leaders and stakeholders from around the world together to come together, to organize, and to plan accordingly. And we, with GAPFund in particular, will have a more structured approach where people will be able to actually set goals, and we'll have timelines, and we'll have metrics to be able to follow the impact that people are having in terms of impacting those important issues at a global level.
Right. I was just putting the name in the answer so the attendees can.
So I guess that's Phil. Is he related to the director, Ferrantino?
Oh, I've never asked you. Are you, Phil?
The film director. I'm just kidding.
Well, we have a celebrity in our midst. So do we have any other questions for Kathy or about Psi Upsilon that we can answer? We thought we might be done a little early, but Kathy, it's truly been a pleasure having you with us this evening, and we have recorded this event, and we'll be posting this on our website with your contact information. And again, if anybody has any questions, I know that several of the attendees have been presenters at Sigma conferences, and Dr. Judge was actually accepted to present in Australia and is contemplating being able to travel. And if not, we're going to catapult her knowledge for one of our programs as well. But we really have appreciated everybody's engagement and certainly your inspirational story and suggestions. Thank you again so much for joining us. It was really just a wonderful evening.
Well, I just want to say thank you for the invitation, and certainly thank you to all the people who took time out of their busy evenings to be with us tonight. It certainly shows your interest, your commitment, your passion for the organization, and we appreciate that. And I look forward. I hope our opportunities and our paths cross. So thank you again.
Thank you so much. And we've got several other great programs on our event schedule for the next 6 months. We've got some presentations about how to write abstracts, how to develop posters for presentation, submitting manuscripts for publication. And in the first week of June, Dr. Carol Houston will be presenting about her book, The Road to Leadership. So we've got some great programs coming up in the next several months. So Kathy, you were the first of many great sessions. Thank you again so very much for joining us. And thank you all for being here this evening. We appreciate it.
Have a good evening, everyone.
Good night. Good night.